You've probably heard financial advisors or bankers say it's never too early and it's never too late to begin saving, especially if it's for your own retirement. Jean Setzfen is Vice President of Financial Security at AARP. She heads AARP's educational and outreach efforts aimed at helping Americans have financial peace of mind in retirement. Jean, thanks for joining us this morning.
Thank you.
So let's start off with this. When should we start thinking about retirement planning?
Oh, it's never too early and it's never too late, quite honestly. But we actually see, based on research, people starting in their 30s. And the sooner you start, the easier it is because you can save over a longer period of time and therefore it doesn't feel as difficult because you can save less. But even if you haven't started until your 50s, please don't consider not doing it. It's never too late either.
And what are some of the real costs of retirement? Some things maybe that a lot of people overlook?
Well, one of the things that we actually notice, actually building a couple of retirement calculators ourselves, that healthcare cost is one thing that people often overlook. And it always has been relatively difficult to estimate how much you need for healthcare costs, but we actually have built a tool that's really simple to use that helps you actually identify your healthcare costs based on your own individual situation. So that's one of the things that we want to do is personalize it to help people actually realize what amount they actually need to save for healthcare costs and retirement.
And what can you tell us about AARP's new health cost calculator? Can you tell us how it works?
It's actually done in four very simple steps. The first thing you do, tell us a little bit about yourself, but keep in mind that this is all anonymous. We're not tracking any of your individual information. We only need to know some personal information about yourself just from a profile standpoint. How old you are, your height, your weight, your gender. And then we move on to actually understanding what your medical conditions are, if you have any. So understanding things like allergies, or if you have a family history in diabetes. Understanding a couple of these medical conditions can help you again fine-tune how much you have to save for healthcare costs. Then we move to the third step of understanding how much you have. First, it actually takes estimates and assumes that everybody will have access to Medicare, and then really estimates what out-of-pocket costs you'll have. And so that's what the third step does. And then fourth, it moves into action steps, really giving you a customized list of things that you should consider, and also things that you can do to reduce your healthcare costs in the long term.
What sorts of tips do you have for us on how exactly we can get going on planning for retirement?
Well, the first thing that we always say, in addition to what we just talked about healthcare-wise, is really understanding what you want out of life, quite honestly. The more that you know what life will look like, it'll actually help you understand the costs much better. Secondly, Social Security is actually a really important aspect to maintaining security in the long term. So understanding the program and knowing when to claim, and always knowing that the later you claim, the more benefits you'll have. And then thirdly, looking at the overall cost of retirement, doing your retirement calculator and also considering your healthcare costs alongside it will get you along the right path.
Jean, again, thank you very much for joining us here this morning.
Thank you.
Now, even with an employer plan, out-of-pocket costs can be estimated as much as $200,000 per couple, and that's just for health care. Despite this number, a new study found that only 1/3 of Americans close to retirement age have even thought about saving for these extra expenses. You can find out more about the health cost calculator on our website, abc10up.com.